matigas ang aking ulo.
Iingatan ko ang aking sarili.
Para maingatan ang pamilya ko.
Ito ang ambag ko.
Ako.
Ikaw.
Lahat tayo.
Sama-sama nating
Mayaangat ang bayan.
Basta't sama-sama tayo.
Sa pag-ingat buhay.
Para sa ating hanap buhay.
Mas hugas iwas.
Magandang tanghali, Pilipinas. Well, nakipag-usap muli po ang ating presidente kagabi sa taong bayan. No? At unang-una po na lumabas po dito sa ating pag-uusap sa taong bayan ay umapila po ang ating presidente sa mga pribadong ospital na taasan ang kanilang bed capacity na nakalaan para sa COVID-19 patients habang patuloy na tumataas ang kaso ng COVID-19 sa bansa. Inatasan naman po ni Presidente ang Department of Foreign Affairs na tignan ang mga kababayan nating Filipino seafarers na stranded abroad sa gitna ng pandemya. Inaprubahan din po ng Presidente ang rekomendasyon ng Task Force on PhilHealth na sampahan ng criminal and administrative cases ang executives ng PhilHealth. Kasama po rito ang dating Presidente na si General Morales at karamihan po ng Executive Committee na minsan ang tinawag ni Senator Ping Lacson na mga members ng mafia sa PhilHealth. Well, kung inyong matatandaan sa aming press briefing nung una ninyong narinig, ang direktiba ni Presidente Rodrigo Roa Duterte na bumuo ng isang panel para imbestigahan ang mga napapabalitang katiwalian at anomalya sa Philippine Health Insurance Corporation. Binigyan ng task force ng 30 araw lamang para isumite ang kanilang report at rekomendasyon. Kahapon, September 14, ang deadline ng task force at naisubmite naman po kagabi kay Presidente ang kanilang report and recommendations. Sa kabuuan, makikita na ang mga taong inaasahan na magbigay ng pulisiya at operational guidelines sa management ng PhilHealth ay walang due diligence sa pagpapatupad ng kanilang tungkulin. Ang tinutukoy ko po ay ang Board of Directors at Executive Committee. Makikita ang lack of due diligence at due care ayon sa task force sa mga sumusunod. Una, ang pag-aproba at pagpapatupad ng Interim Reimbursement Mechanism or IRM ng walang sufficient standards. Pangalawa, ang pag-aproba ng PhilHealth Information and Communication Technology Budget dahil lamang sa sinabi ng SVP in charge na babagsak daw di umano ang buong management information system ng PhilHealth kung hindi maaproban ang budget. Pangatlo, ang pag-adapt ng corporate policies at practices na nabigong tignan, imbestigahan, usigin at bigyan ng karapatang parusa sa mga PhilHealth personnel, healthcare institutions at professionals na nagkakasala. Sa IRM, makikita ang lack of due care, if not outright negligence, sa pag-aproba at pagpapatupad ng IRM. Sangayon sa report ng task force, makikita ito sa mga sumusunod. Ang minadali ang IRM fund releases kahit na hindi pa epektibo ang circular na nagpapatupad ng scheme. Nasa batas na kinakailangan makadeposit muna sa Office of the National Administrative Register ang circular na hindi nangyari sa kasong ito. Ipinatupad ang IRM na walang sapat na standards and guidelines kaya naabuso ang fund releases. Tinanggal sa circular ng prior board approval for IRM fund releases tuwing mayroong fortuitous event na mangyayari. Tinanggal din ang ilang requirements tulad ng survey at post-survey requirement at sinentralize ang evaluation ng IRM fund beneficiary sa Office of the President and Chief Executive Officer. Ginawa ang IRM fund releases kahit walang mekanismo para i-monitor ang fund utilization at liquidation at non-withholding of taxes. Itinago ng ilang miyembro ng Executive Committee ang mahahalagang impormasyon o mga dokumento para makuha ang board approval sa ICT procurement. Inandap din ng PhilHealth Management ang mga questionabling polisiya at mahinang pagpapatupad ng practices na nabigong tignan, imbestigahan, usigin at parusahan ang mga pagkakasala. Kasama rin dito ang pag-adapt ng pulisiya para sa settlement ng claims ng walang accountability at pagbibigay ng wholesale amnesty pabor sa healthcare institutions or HCIs. Kabilang dito ang mga kaso na mayroong kinalaman sa fictitious crediting of remittances, ang penalty na pagsususpinde ng operasyon ng ginawang payment of fines ng board at libu-libong may kinalaman sa healthcare insurance at mga empleyado ng PhilHealth na hindi man lang kinasuhan. Naka-flash naman po sa ating screen ngayon ang liability ng PhilHealth Board at corporate officers. Ang sabi po nila, meron po talagang negligence, no? At ito po ay lumalabas nga po dahil nga po doon sa pagpapatupad ng IRM, doon sa computer program, at doon sa kapabayaan nila na parusahan yung mga nangungutong sa PhilHealth. Now, nagrekomenda po ang task force ang pagsasampa ng mga kasong kriminal laban sa mga taong nagrekomenda ng proposed ICT procurement, nag-disburse ng IRM funds bago ang effectivity ng circular, at nag-release po ng IRM funds kahit na walang sapat na standards for implementation, at saka po yung non-withholding of taxes sa IRM disbursements. Sino-sino po itong rekomendahang sampahan ng kaso? Una po yung dating presidente na si General Morales, at yung SVP Lim Siaco. Kasama rin din po dyan yung COO De Jesus at saka yung SVP Pargas. Kasama rin po yung SVP Aragones at among others, no? Aragones at saka Gabuya and Division Chief Crisostomo. Okay. Now, kahapon po, sinimulan natin yung paghihimay natin ng Bayanihan 2 Act o yung RA 11494. Sinimulan po natin kahapon yung saan pupunda yung almost 165 billion na pondo ng galing sa kaban ng taong bayan. No? At ngayon naman po, tignan natin ang ilan sa mga special powers na ibinigay ng batas sa ating presidente. Unang-una po, kasama po dyan yung kapangyarihan na magkaroon ng deployment of critical information and communications technology infrastructure tulad ng additional cell towers, equipment, software at wireless technologies sa buong bansa. Para magkaroon ng katuparan nito, ilan sa mga measures ang mga sumusunod. Una, pansamantalang suspensyon ng requirements para makakuha ng permits at clearances sa pagtatayo ng telco at internet infrastructure. Pangalawa, pag-streamline sa regulatory processes at procedure para magkaroon at mapabuti ang digital internet at satellite technology infrastructure. Ano pong ibig sabihin nito? Lahat ng pending at new applications para sa pagpapatayo ng bagong cell sites, cell towers, rollout ng fiber, paglalagay ng poles, ground terminals at iba pang mga kinakailangan madesisyonan sa loob ng 7 working days mula sa araw ng matanggap ang date of application. Ito po ay non-extendable. Ang application na hindi po aaksyonan sa panahon na iyon ay deemed approved. Isa lang po ibig sabihin nito. Wala na pong lusot ang ating mga telecoms providers kung palpak pa rin ang kanilang serbisyo. Lahat po ng hiningi nila, binigay na natin. Tignan po natin. Pagkatapos ng Bayanihan 2 sa Disyembre ng taong ito, dapat maganda na ang serbisyo ng mga telecoms company. Isa rin sa mga special powers ay ang pagdidiscontinue ng appropriated programs, activities at projects ng anumang ehensya sa Executive Department na hindi magagamit dahil nga po sa COVID-19 outbreak. Kasama rito sa pwedeng i-discontinue ang discretionary foreign travel, representation, mass events at iba pa. Prioridad naman para sa budget augmentation ang mga sumusunod. Sa DOH, yung operational budgets ng mga ospital ng gobyerno, temporary treatment, isolation, quarantine and monitoring facilities, prevention and control of other infectious diseases, emergency preparedness and response at quick response UP. Para naman po sa pamantasan ng Pilipinas, yung operational budget ng ating Philippine General Hospital. Sa National Disaster Risk Reduction and Management Fund or Calamity Fund, sa mga programa ng DOLE tulad ng CAMP, TUPAD, AKAP para sa OFWs, sa TTI, Livelihood Seeding Program at Negosyo Serbisyo sa Barangay. Sa DA, ang Rice Farmers Financial Assistance Program. Sa DepEd, ang School-Based Feeding Program, Digital Education, Digital Infrastructure, Support to Alternative Learning Modalities, at Printing and Delivery ng Self-Learning Modules. Sa iba-ibang programa sa ilalim ng DSWD, Assistance to Individuals in Crisis Situations, Distribution of Food and Non-Food Items, Livelihood Assistance Grants at Supplemental Feeding Program para sa daycare children. Sa DPWH, Local Infrastructure Programs, at under allocation sa LGUs, kasama rin ng special powers ang pag-enforce ng bed capacity allocation ng government at private hospitals na nakalaan sa COVID-19 response. Kapag may surge ng COVID-19 cases, at least 30% ng bed capacity ng government hospitals ay dapat ilaan po sa COVID-19 patients. At least 20% naman po ng bed capacity ng pribadong hospital ay dapat ilaan sa mga COVID patients. Binibigyan din po ng otoridad ng Presidente na idirect ang operation ng private establishments tulad ng private hospitals at passenger vehicles para maging tirahan ng health workers o maging quarantine areas, quarantine centers, medical relief at aid distribution locations at pampublikong transportasyon ng mga health, emergency at frontline personnel. Tulad ng sinabi ko po kahapon, ang Bayanihan 2 ay hindi lamang para sa mga health workers. Sa mga gurong nagtatanong, meron pong ayuda na nakalaan sa inyo. Ito po ay 300 million na subsidies at allowances para sa mga na-displaced na teaching and non-teaching personnel, including part-time faculty sa pribado at pampublikong paaralan ng elementarya, secondary at tertiary level kasama rin dito po ang part-time faculty sa mga state universities and colleges. Yusek Malaluan, I hope you read this provision of the law. COVID-19 update naman po tayo. Ito po ang global update ayon sa Johns Hopkins University. Meron na pong 29,159,839 cases sa buong mundo. At meron na po tayong 926,307 deaths. Nangunguna pa rin po sa top 5 ang Estados Unidos. Meron po silang 6,552,590 cases, samantalang mga namatay ay 194,466. Pumapangalawa pa rin po ang India, 4,846,427. Ang deaths po nila ay 79,722. Ang Brazil ay pangatlo pa rin po, 4,330,455 with 131,625 deaths. Ang Russia po ay pang-apat, 1,064,438 cases at 18,573 deaths. Ang Peru ay pang-lima, 729,619 cases and 30,710 deaths. Sa Pilipinas po, meron na tayong 265,888 cases at ang deaths po natin ay 4,630 or 1.7% case fatality rate. As of September 14, meron na po tayong test ng mga kababayan natin. Na-test na po natin ang mga 2,921,142 na mga kababayan natin gamit po ang RT-PCR. Ito po ay ginawa sa 93 licensed RT-PCR labs at sa 29 licensed gene expert laboratories. Ang aktibong kaso po ng COVID-19 ay 53,754. Samantalang sa numero pong ito, ang asymptomatic ay 8.2%, ang mild ay 88.4%, ang severe ay 1.3% lamang at ang critical ay 2.1% lamang po. Madami po ang ating recoveries. Ito po ay 207,504. Mga namatay po, gaya ng sinabi ko kanina, ay 4,630. Nakikiramay po kami sa lahat ng mga naging biktima. Ang mabuting balita po, pagdating po sa ating critical care capacity, wala po tayong problema. Sa ICU beds, 50% pa po ang available. Sa isolation beds, 56% pa po ang available. Ang ward beds natin, meron pa pong 52% available. Ang ventilators natin ay 73% available. Ganun pa man, kinakailangan po ingatan natin ang buhay para tayo maghanap buhay. Ayaw po nating mahospital kayo. Madali lang po yan. pagsuot ng mask, paghugas ng kamay, pag-iwas, at pagsuot ng face shield sa mga lugar na dapat nakapag-face shield po. Well, kasama po rin natin ngayong araw ang dalawang panauhin natin. Kasama po natin, walang iba po kundi ang kalihim po ng TESDA, si Secretary La Peña, para bigyan po tayo ng summary kung paano po nakakatulong ang TESDA sa panahon ng pandemya na ang dami-dami nating mga OFWs na bumabalik dahil nawalan ng trabaho at ang dami rin nating mga kababayan na nawalan ng trabaho. Paano kaya po nagre-retool o nagre-retrain ang TESDA? Paano makapag-avail ng training ng TESDA? Saan pupunta? At ano itong mga programang ito? At siyempre po, medyo matagal na nating nakasama. Alam nyo naman, pag hindi natin nakasama linggo-linggo itong aking tinutukoy, ang Chief Implementer ng National Task Force, parang naliligaw ako. No? So kasama rin po natin ngayon si Secretary Galvez, Chief Implementer ng NTF, National Task Force on COVID-19. So unahin po muna natin si Sec Galvez, Chief Implementer. Nasaan na po tayo sa laban natin sa COVID-19? The floor is yours, Secretary Galvez.
Salamat po, Secretary Roque. Takana po na bumubuo ng National Task Force Against COVID-19 sa ilalim po ng pamumuno ng Depensa Secretary Del Quito Rexana at Interior and Local Government Secretary Eduardo Ano. Isang magandang tanghali po sa ating lahat. Noong nakaraang linggo, dineklara ng University of the Philippines of the Research Institute na naplate na natin ang COVID-19 curve sa ating bansa. Pero sinasabi po natin, ngunit katulad po, nasabi natin, hindi tayo maaaring magkumpiyansa, kinakailangan tuloy pa rin natin po ang magandang nasimulan at ang ginagawa po natin ngayon. Ito ay upang magtiyak na hindi makakaroon ng tinatawag na second wave of infections. Maganda pong balita po natin at sa ngayon po, sinabi nga po ni Secretary Roque, kapag kanabas na po tayo ng 3 million tests na kita po natin sa pamagitan ng ating testing charge ni Secretary Beans, meron po tayong 2.9 million individuals na test na po at ito po ay 2.6% ng ating population. Nag-average na po tayo na 30,000 plus daily test average at natutuwa po kami dahil na-break na po natin ng 40,000 mark. Nagkaroon po tayo ng 43,555 highest daily output last September 10, 2020. At yung po ating mga testing laboratory, aside from sinabi po natin na meron na po tayong 122 na laboratory, meron pa po tayo na nag-apply na 102 na magpapalicense. At ito po ay nasa 70% po yung mga stage 3. At natutuwa po kami, kasama po yun dyan sa ay nagkaroon na po ng tinatawag nating LTO. And then, magmula po na mag-pick tayo ng mga bagong cases ng first at saka second week ng August, dahil sa aggressive natin na pagtanggal ng mga positive cases sa mga kanilang kabahayan, bumababa na po ang ating bagong cases dahil nakatulong po tayo na mayalis ang mga COVID positive sa kanilang mga bahay kaso pag nagsimula po noong Agosto. Sa pamamagitan ng programang Oplan Kalinga, sa pamuno ni Secretary Vince Dizon at Director Mike Salalima ng MMDA, tinutulungan po natin na mga COVID positive ay mailipat sa mga isolation or quarantine facilities mula sa kanilang mga bahay. Sa pagka-quarantine ng ating mga COVID positive patients, meron tayong 20 mega quarantine facilities, pero bukod po doon ay kumuha po tayo ng 29 hotels all over NCR, Region 4A at Region 3 na may capacity na 2,622 beds. Sa kabuuan po ay nakapag-isolate po tayo ng 24,538 na pasyente or yung COVID positive. At napakalaking tulong po nito na epektibo po natin na may baba ang ating mga cases sa NCR. Kung titingnan po natin sa mga datos natin noong August 14, 88,109 ang ating kaso na active cases. Ngayon po ay mayroon na po tayong 53,754 noong September 14 Ibig sabihin po, napababa po ng 34,355. So kung titingnan po natin, napakalaki po ang naitulong po na i-isolate natin yung 24,538. Kung hindi po natin na-isolate yan, baka may dagdag po tayo ng 100,000 na new cases. And it will be compounded and exponentially increase. So napakalaking tulong po talaga ng Oplan Kalinga. Then tinitingnan din po natin ang tinatawag natin ng mga non-COVID cases. Kasi ang sa ating strategiya at sa ating plano, tinitingnan din po natin ang ating tinatawag na non-COVID patient. Kasi yun po ang sabi po ni Dr. Sanyel na aking isang tinatawag naming eksperto na pagka once na nag-commit tayo ng mga beds para sa COVID cases, ay nagkakaroon din ng compromise sa mga non-COVID cases. So tinitingnan po natin ito, katulad po ng ginawa po natin sa Cebu, na nagbigay po tayo ng more or less ng mga 20 dialysis machines galing po sa ating mga business sector. So yun po, sa datos po ng DOH, ang pinapataas na cause of death at mga communicable diseases kagaya ng TB, non-communicable diseases kagaya ng heart disease, hypertension, diabetes at saka cancer. So yun po ang sinasabi po natin sa ating mga LGU, kung na pong maaari, magkaroon sila ng desisyon na magkaroon sila ng COVID dedicated hospital at saka mga tinatawag nating non-COVID hospital para po hindi ma-compromise ang ating mga tinatawag na mga critical patient. And then tingnan po natin sa huling bilang na mayroon po tayong 122 level 3 hospitals. Ito po yung mga hospitals na may kakayahan po na magkaroon ng surgical at saka mga intensive care unit. Kulang na kulang po ang ating lumalaking populasyon, ang tinatawag nating mga bed allocation. Kung titingnan po natin, the country has around 108,000 hospital beds as of 2019. O yung kung titingnan po natin sa 1,000, for 1,000, kailangan meron pong isa. Sa average, ay nakikita po natin na talagang tayo po ay naiiwan. So meaning meron po tayong dapat na 54,000 additional beds. So ito po ang ginagawa po natin, katulad po natin ng DPWH, pumunong ng Secretary at saka ng DDOH, Secretary, na kailangan ma-increase ang level 3 hospitals natin, lalo na sa Region 3 and 4, para hindi po magkaroon na tinatawag nating ma-overwhelm ang NCR. I-increase din po natin ang mga tinatawag natin mga facilities doon sa mga regional hubs, katulad ng mga city natin sa Visayas at saka sa Mindanao. Ito po ang tinitingnan po natin para at least makita po natin na yung ating strategic move na habang ginagawa po natin ang pag-response sa pandemya, titingnan din po natin ang tinatawag natin yung future natin ng mga gaps. Magamit po natin yung mga tinatawag nating mga bayanihan funds para mailaan po na magkaroon po tayo ng mga additional beds at saka magkaroon po tayo ng hiring ng more or less 10,000 na healthcare workers. Yun po at maraming po salamat. Back to you, Secretary Roque po, sir.
Maraming salamat, Secretary Galvez. I hope you can join us for our open forum. I'm sure maraming tanong po yung mga kasama natin dito sa Malacanang Press Corps. At gaya na akin nasabi kanina, kasama rin po natin ang ating Secretary La Peña ng TESDA. Ano ba ang mga programa ang pwedeng ma-avail na ating mga kababayan, lalong-lalo na yung mga OFWs na napauwi at yung mga natanggal sa kanilang mga trabaho. Secretary La Peña, the floor is yours.
Maraming salamat sa iyo, Secretary Roque. And thank you for this opportunity given to TESDA to update our kababayans on the efforts and initiatives that we have been doing to help our country in our fight against the current COVID-19 pandemic. I would like to share to our kababayans that immediately upon the declaration of the enhanced community quarantine in March, we at TESDA immediately crafted the plan TESDA Abot Lahat, Tibet towards the new normal. This contained the guidelines and policy directions in response to the ongoing crisis and the ways forward post-pandemic. Please allow me to report to our people some of the more important actions that we have initiated as we join the whole of government approach to address the pandemic. Next slide, please. At the onset of the pandemic, TESDA immediately responded by expanding and intensifying the TESDA online program, accessible via www.tesda.gov.ph t.tesda.gov.ph and develop blended and flexible learning modalities. Next slide, please. We actively promoted to the public the free and easily accessible online courses from TESDA. As such, at the start of the enhanced community quarantine, we saw the spike in the number of people registering in the platform. Until now, thousands of individuals in the country and Filipinos in foreign countries continue to enroll in the TESDA online program. Next slide. During the quarantine period, from March 16 to September 13, total registrants in the program reached 908,396. Some 71,251 of these are OFWs or their dependents. Next slide. These were 965,929 total enrollments during the period. 152,992 learners have already completed their courses. Next slide. We have also added relevant and timely courses for added usefulness of the TESDA online program to the public. And these are practicing COVID-19 preventive measures in the workplace, facilitating e-learning sessions, performing proper waste management in the workplace. Next slide, please. Another good news to the public. We have partnered with Globe Telecom to make TESDA online program more accessible, even for those who have no data or internet connection. Globe subscribers can access the TESDA online courses even without their data load. To also help our people start a simple and relevant livelihood project, we made a tutorial video on how to make face masks. This is also available in the TESDA online program. Next slide, please. At the onset of the pandemic, TESDA also immediately called on all TESDA technology institutions, regional and provincial offices to help the country provide free face masks, disinfectants, and other personal protective equipment to those in need. We distributed this to the frontliners from the hospitals, health centers, barangays, LGUs, and even police officers and military at the checkpoints. Next slide. As of September 10, TESDA has produced the following, as shown in the chart: 420,433 face masks, 40,807 face shields, 1,205 goggles, 10,060 protective suits, 12,621 sanitizers. We also saw the need to help affected communities with their food supplies and quickly acted on it. It is good that we have many organic farms in all TESDA training centers located nationwide. TESDA's advocacy for agriculture sector as well as food security help us to immediately respond even during the pandemic. Next slide, please. Our mini organic farms have been the source of farm products that were distributed to 29,345 individuals in the nearby communities. Our latest data also show there were 197,580 beneficiaries of TESDA prepared food packs made by TESDA trainers. Next slide. In summary, we were able to produce and distribute 181,854 baked products, 85,835 food packs, 5,739 kilos of organic vehicles, 7,770 various seeds and seedlings nationwide. Next slide, please. As OFWs are forced to return home due to the pandemic, we also launched in June the TESDA Abot Lahat ang OFWs. This was an offshoot of the first consultation we had with the global OFW community last May. We provided easy access and registration for skills training. We created a special link on the TESDA mobile app where OFWs, including their dependents, can easily fill out the registration form. At present, there are 4,939 OFWs who have registered online. Next slide. Aside from that, TESDA regional and provincial offices set up their respective OFW desks, which is dedicated to attend and assist OFWs. This is apart from the existing TESDA Malasakit Help Desk located at the airport. Because of our close coordination with the OFW community, we have now an ongoing training on scaffolding works inspection with a former OFW as a trainer. This online training is attended by OFWs from different regions, former OFWs, and even those who are currently abroad. Next slide. The effects brought about by the pandemic affected workers from various sectors, including the technical vocational education and training sector, or TVET. Next slide. TESDA assisted some 18,432 trainers and assessors in their application for DOLE's COVID-19 Adjustment Program, or CAMP. So far, 2,276 applications have been approved and the rest are still being processed. Next slide. As there are private tech-voc institutions or TVIs who felt the impact of the pandemic, TESDA devised a more flexible payment arrangement so that the affected private TVIs who were already implementing scholarship programs or trainings at the time of the imposition of community quarantines will be given equitable compensation. Next slide. Next slide. Under the new normal, using the blended and flexible learning modalities, TESDA's trainees or scholars are supported with a training allowance of 160 pesos per day, additional 500 pesos for data or internet allowance to support their online training, 1 year accident insurance, and another 500 pesos for their health protective equipment for them to be ready and safe as they start their training with us. Next slide. The pandemic also prompted TESDA to develop competency standards for contact tracing. Next slide. Last July, TESDA, together with the Department of Health, developed the competency standards for contact tracing level 2 to respond to the need to train contact tracers to stop the spread of coronavirus. TESDA National Capital Region launched the first batch of contact tracing level 2 training program last September 9. This will be followed by all TESDA regional offices nationwide. Next slide. We are also conducting our other health-related training programs nationwide. Next slide. Consistent with the government's trust on food security during the pandemic, TESDA, being the lead agency of the Poverty Reduction, Livelihood and Employment Cluster of the National Task Force to End Local Communist Armed Conflict, and being a member of the IATF Sub-Task Group on Food Security, work with other government agencies and private partners in implementing development projects in priority barangays or geographically isolated and disadvantaged areas, or GIDAs, in all regions of the country. Next slide. Some of the successful development projects that TESDA has launched are as follows. In Region 11, the AGAC Center. Next slide. This project aims to assist, protect, and sustain IP communities. Next slide. With LEDTech Incorporated as AGAC Center Operator and IHO Resources as Processor, which buys pre-processed agri-products of the indigenous peoples. Next slide. AGAC Center was first established in Prosperidad, Montevesta, Davao de Oro, and is now replicated in 11 other locations in the areas, including Davao del Norte. Next slide. TESDA Region 11 has also partnered with San Miguel Corporation in the implementation of other development projects. And San Miguel Corporation initially provides chicks under the training com production scheme and subsequently purchased them after 28 to 30 days, mga about 1 kilo na yan. Next slide. In Region 12, we have TALA or TESDA Alay ay Liwanag at Asenso. Representatives of at least 100 households in Situ Blit, Barangay Ned in Lake Cebu, South Cotabato, were trained to install and maintain solar lights inside their homes. This is after 70 years of living without electricity. Finally, this place was lighted. And of course, agricultural, organic production follows. In Region 8, we have the AKAP, Project or Agrikultura at Kabahayan tungo sa Kaunlaran at Pangkapayapaan Project. The beneficiaries of this program are former rebels in the Peace and Prosperity Village in San Isidro, Leyte. Next slide. The Filipino people can expect more from TESDA, and we will continue delivering services despite the challenges and risks brought by the pandemic. It is during this most difficult time that we have to do more for the people. TESDA is one with the nation. We will heal and recover as one. Maraming salamat po.
Maraming salamat, Secretary La Peña. I hope you can also join us for our open forum. Simulan na po natin ngayon ang open forum. Let's call on Yusek Roque, please.
Yes, good afternoon, Secretary Roque. Good afternoon, Secretary La Peña and Secretary Galvez. From Tina Mendez of Philippine Star, please provide daw po context on President Duterte's statement saying he does not want to the Philippines to give cash advance to Western countries to ensure access to the vaccine against COVID-19. Does it mean the government won't pursue participation in Gavi COVAX Vaccine Alliance? Are we withdrawing participation from this alliance?
Hindi po. We will continue our membership in the alliance. Ang konteksto lang po, sinasabi niya na mga Western companies ngayon pa lang humihingi na ng kumbaga reservation fee. Samantalang ang bansang China at Russia, wala pong ganyang hinihingi at po pwede pa nga utangin kung magkakaroon sila ng vaccine. Maricel Halili, please, of TV5.
Hi sir, magandang hapon po. Sir, regarding dun sa report ng Task Force on PhilHealth, why was there no mention about Health Secretary Francisco Duque? Or is he part of the recommendation submitted by the task force?
Well, the task force said that there was negligence on the part of the members of the board, including the chairman, no, and the members of the board. No? So it's not just Secretary Duque, there's also the ex-officio members of the board, no, which includes at least 5 sitting secretaries. No? Now, having said that, the report also said that somehow their negligence in allowing the IRM, in allowing, in voting for the ICT contract, and in the failure to investigate and prosecute perpetrators of fraud in PhilHealth were somehow mitigated by the fact na maraming mga dokumento at mga facts na itinago ang mga miyembro ng EXECOM sa mga members ng Board of Directors. So sa rekomendasyon po na pinasa naman ni Presidente, ang rekomendasyon ay strong admonishment sa chairman ng PhilHealth at sa mga members of the Board of Directors na kinakailangan talagang pinag-iingatan po ang mga salapi na galing sa kaban ng taong bayan.
Sir, does it mean that Secretary Duque is not yet absolved of any charges in relation to PhilHealth issue?
This is only the beginning, no? Nakasaad din po sa report na magpapatuloy po ang investigasyon ng NBI at ng DOJ. At magpapatuloy pa rin po ang mga investigasyon ng Ombudsman. Last week po, nag-request po sa akin sa Ombudsman to clarify na although they are cooperating with the task force, they do not form part of the task force because they are a constitutional body. So tama naman po yun. No? Pero I understand that the Ombudsman will continue also with its investigation. So ito po ay pauna lamang given the very limited period of time na binigay po sa task force to come up with its recommendations.
And sir, one last na lang po, clarification lang on the statement of President Duterte. Last night he mentioned na hindi dapat paniwalaan yung mga criticisms coming from Dilawan. is he referring to a particular issue, or what particular issues is he referring to?
He was referring to COVID po, and the fact that we have made inroads in the fight against COVID being denied by the Dilawan and the opposition.
Thank you, Secretary.
Thank you very much, Maricel. Let's go back to you, Sec. Roque, please.
Secretary, from Celerino Monte of Manila Shimbun, the President did not read anything about Secretary Duque from the task force report about PhilHealth last night. Is Secretary Duque exonerated from possible charges, both criminal and administrative? If so, did the President not consider also the recommendation of the Senate?
Already answered na po. Tinanong na po yan ni Maricel Halili.
From Rose Novenario of Hataw, may ilang mall po ang hindi kinikilala ang IATF Media ID at hindi pinapapasok dahil walang quarantine pass gaya ng City Mall sa Imus, Cavite. Tama po ba daw ito? Kung hindi, ay ano po ang parusa sa establishmento?
Sa tingin ko po, dapat in-honor naman ng IATF IDs that because that makes you an authorized person outside of residence, APOR. Pero pagdating po sa parusa, wala naman pong parusa yan. No? Yan po ay nakabase sa ordinansa dahil wala nga po tayong pang-nasyonal na batas na umiiral pag meron pong quarantine. At hinihimo ko po muli ang Kongreso na bumuo ng ganyang batas.
From Chris Jose of Remate Online, pabor po bang Malacanang sa apela ni Bagong Henerasyon Party List Representative Bernadette Herrera D na ilagay sa immigration watch list at maglabas ng whole departure order laban sa mga opisyal ng PhilHealth na isinasangkot sa malawakang korupsyon sa loob ng ahensya? Hiniling din niya na maglabas ng legal authorization ng DOJ at NBI para ma-secure ang mga files at computers sa PhilHealth na maaring magamit na ebidensya sa mga akusado. Posible daw kasi na magkaroon ng pag-delete sa mga files, pag-recover sa electronic trail at pagsira sa mga ebidensya.
100% in agreement. Magaling po talaga itong si Congresswoman BH. Next question from Tricia Terada, please, CNN Philippines.
Good afternoon po sa inyo, Secretary. Sir, just a further clarification about the reduced physical distancing, because in an interview, Interior Secretary Eduardo Años said that the new social distancing rule, which took effect on Monday, was not approved by the IATF. Sir, we'd like to ask for clarification about this. Hindi po ba talaga ito na-aprobahan ng IATF? Because, sir, I remember in the IATF Resolution 69 and 70, hindi nga rin po ito nakapaloob.
What was approved was increased transportation, no? Ang ibibigay natin sa ating mga kababayan dahil nga po nagbubukas tayo ng ekonomiya. Yung detalye po, iniwan natin sa mga lead agencies gaya ng DOTR. Bagamat ako po, umattend po ako ng meeting na yon, narinig po yan, yung pagbabawas sa social distancing pagdating sa papublikong transportasyon na naaprubahan po dahil diniscuss po yan dun sa IATF meeting at hindi naman po tumutol ang DOH. Pero gaya ng aking sinabi po kahapon na rin, no? Pag-uusapan po ngayong hapon yan sa IATF meeting dahil hindi naman po pwedeng baliwalain ang mga sinasabi ng mga medical frontliners sa panahon ng pandemya.
Secretary, will there be at least a move to suspend this ongoing new physical distancing rule? And sir, sabay ko na rin, kasi kung ang goal po is to accommodate more commuters, may nag-raise din po ba sa IATF na dagdagan na lang instead yung mga ruta for public transport, na bakit daw po hindi ito yung gawin instead of reducing the distance? And finally, may aasahan daw po ba tayo na resolution tonight?
Meron pong magkakaroon po ng resolution dyan. Kung wala talagang resolution, the President will decide. And I think that was very clear yesterday. No? I myself told the President that I was taking a middle ground on this issue, knowing na importante talaga na magkaroon ng additional transportation para mabuksan ng ekonomiya and observing na wala ngang objection yung DOH during the IATF meeting, although Secretary Duque was not present in that meeting. Pero at the same time, tingnan po natin yung datos na ipapakita ng mga medical frontliners at ikukumpira rin natin to sa ibang mga pag-aaral na ginagawa sa buong daigdig dahil hindi lang naman po tayong merong mass transport system. No? Halos lahat po ng bansa sa daigdig meron, pero parang tayo lang po ang nag-impose ng 1 meter distancing sa mga mass transportation modes. No? So magkakaroon po yan ng resolution and although we don't have a regular press briefing tomorrow, as soon as the meeting ends, I will issue a statement kung ano pong napagkasunduan pagdating dito sa mass transportation.
Secretary, last question na lang po tungkol naman po dun sa naging findings ng task force, initial findings ng task force PhilHealth. Kung nabanggit nga po doon yung recommendation to strongly admonish yung PhilHealth chairman, that's Secretary Roque,
And the board.
the members of the board.
Yes.
Secretary, ito po bang negligence nila? Isn't it somehow tantamount to incompetence na kumbaga it got past them, all these things got past them?
I can only quote the report. There was negligence, somehow mitigated, nabawasan, no? Dahil nga po, tinatago naman ng Execom yung mga katotohanan sa mga miyembro ng board.
Salamat po, Secretary.
Maraming salamat, Trish. Going back to Yusek Roque, please.
Secretary, from MJ Blanca Flor of Tribune.net.ph, it's been 6 months since the government imposed varying quarantine classifications. How will you assess the country's response to COVID-19? Ano po ang gradong ibibigay nyo sa ating pandemic response?
I don't know if I can give a grade, no? Kasi ang tinuro ko sa UP, international law at constitutional law, no? So I'm not used to giving grades. However, we'd like to highlight that number one, yun nga po, no, yung expectations ng mga dalubhasa, mga mathematicians na aabot na tayo dapat ng 3 million nung buwan pa ng Hunyo, hindi po nangyari yan. Pangalawa po, mababa po ang ating case mortality rate. It is only at 1.7 at yan naman po ang importante kapag may pandemya, dapat pangalagaan ang karapatang mabuhay ng mga mamamayan. At pangatlo po, yung ating health system hindi po overwhelmed. 50% pa nga po ang available capacity ng ating ICU beds, ng ating ICU wards at ng ating mga hospital rooms at 76% o 74% ang available ventilators pa natin. So all in all, I think we deserve a very good grade. I would give it a grade of 85%.
In our four strategies, testing, tracing, isolation, and treatment, what should be improved? What are our strengths and weaknesses?
We clearly have the best testing policy in the whole of Asia and probably in the whole world because we have exceeded 3 million, no? And as a percentage of total population, ano na po yan, no? Lubos-lubusan na yan doon sa sinasabi nilang 3%, no? Na dapat matest ang population. At patuloy pa po tayo, no? So dadami po tayo. And I think we will have the highest number of testing, one of the highest in the whole world. So that's clearly our biggest strength. We need to brush up po on our tracing at ngayong na-approve na po ang Bayanihan 2 and we will have 5 billion allotted for additional tracers. Tingin ko po, we will have major inroads and successes using also the Magalong formula na kailan lang naman pong natalaga bilang tracing SAR. Kinakailangan din po natin na mas marami pang mga isolation facilities kung ipatutupad po natin yung gusto mangyari nga po ni Secretary Anyo na wala na talagang mag-home quarantine. One limitation of course is we don't have enough isolation facilities so dapat mas marami pang isolation facilities ang ating itayo. Pagdating naman po sa treatment, I think the fact that 1.7% lang po ang case mortality rate proves that Filipino doctors know how to take care of COVID patients now. So alam na po natin yung mga gamot na available, Remdesivir, Avigan, tapos may contribution pa tayo, ang virgin coconut oil, ang tawa-tawa, ang lagundi, at alam na po natin na mas nakakabuting gamitin yung high flow oxygen cannula kesa sa mga ventilators.
Opo, ang susunod yung tanong, how will the government address criticisms that health experts and medical groups are not consulted in drafting policies being implemented? Is Secretary Duque still in charge of the IATF, which serves as the policy-making body of our pandemic response?
Wala pong katotohanan yan. Ang DOH pa rin po ang tumatayong lead agency sa IATF. Pinangungunahan po ng isang doktor, si Dr. Duque. Bukod pa po dyan, ang ating epidemiologist ay si Dr. Wong at ang ating mga USEC po, lahat ay doktor. Si USEC Vergere, si USEC Tong-an, si USEC Vega at saka si USEC yung sa classification. Lilibeth, si Yusek Lilibeth, siya po yung nagbibigay sa atin ng guidance pagdating dun sa classification na ipapataw sa iba't ibang lugar. Wala pong hindi doktor ang nagbibigay ng pulisiya pagdating po sa COVID. Siyempre po, tumutulong po ang lahat, no? Because we're employing the one nation approach pagdating dito sa pandemyang ito. Thank you. Now we go to Melo Acuña, please.
Good afternoon, Secretary. Hindi ko narinig kung anong bansa yung gustong humingi ng down payment. Bagaman sinabi ng Pangulo na yung Russia at yung China, baka pwede pang magpautang. Ano po kayo mga bansa yun?
Sinabi po niya kahapon Western.
Would we be more specific?
Hindi po niya sinabi, so I cannot be more specific. Western countries po.
But Secretary, there's another issue because I came upon the budget proposal for the Department of Health for next year. From 181 billion this year, nabawasan po ito at naging 128. Pero tumaas po yung budget ng DPWH at ng Department of Transportation. Ano po kaya ang logic dito?
Well, kasi po yung mga isolation facilities, yung mga hospital, nakapaloob po yan sa budget ng DPWH. Kaya nga po ginawa nating isolation SARS si Secretary Villar. No? So lahat po yung mga additional bed capacity, hindi naman po yan pumapasok sa budget ng Department of Health. Yan po ay public infrastructure spending pa rin sa ilalim po ng Department of Public Works and Highways. Now sa transportasyon po, hindi ko po alam ang detalye, no? So I cannot answer you right away. Pero alam naman po natin na habang nagbubukas ang ekonomiya, dapat mas importante ang papel ng transportasyon dahil hindi makakapunta ng trabaho ang mga manggagawa kung walang public transportation. At alam po natin na at 16.5 contraction, talagang malala po ang problema natin sa ekonomiya, kaya dapat gawin ang lahat para mabuhay muli at makabangon ang ating ekonomiya.
Opo. Para po sa ating mga kasama sa TESDA, may tanong lamang po ako.
Secretary La Peña.
Secretary La Peña, magandang tanghali po sa inyo. Nakapagsanay na po kayo ng mga OFW na umuwi. Ano po kaya ang kinabukasan naghihintay sa kanila? Ano pong trabaho ang in-demand sa labas at sa loob ng Pilipinas? At meron na po kayang nakapasok ng trabaho matapos magsanay sa inyo? Salamat po.
Well, maraming salamat sa katanungan po ninyo. At present, meron tayong mga 73,000 OFWs at saka mga dependents nila who have enrolled and graduated in TESDA's skills training programs. Kasama na po dyan yung training sa TESDA's online program natin. At yung mga trabaho po na in need ngayon ay mga yung sa agriculture, construction, IT, BPM, health and wellness, logistics and marketing also. At yung aming survey na yung mga nagtre-train po sa amin ay we have a 85% employability rate. So more likely, our OFWs that were trained are either employed or they have their own businesses or livelihood po. And we continue to train our OFWs as stated earlier na meron kaming online na TESDA apps for registration and for enrollment. And then kung meron pong mga nakaregister na dyan, our regional offices at saka mga provincial officers namin reach out to them para makausap sila kung ano yung mga interest nila, anong skills yung gusto nilang mga ma-train. At saka after that, they will be helped na magkaroon po ng trabaho. Ang TESDA po kapag nag-train, it should result to a job or a livelihood after. So ganun po ang ginagawa ng TESDA sa ating mga kababayan.
Nabanggit po kasi ng Asian Development Bank kanina sa kanilang economic briefing na bababa pa ang ating growth rate by 7.3% hanggang sa pagtatapos ng taon bago makabawi next year. Pero ano po kaya ang impact nito sa employability ng mga nasanay ninyong mga OFW at mga Pilipinong naghahanap ng trabaho?
Well, tama po yan because of the slowdown ng economic activities natin. That's why ang pinagtutunan namin ng importansya are on the dito po sa agriculture field. Kasi sa agriculture field, that is a continuing training at saka ang demand po dyan ay dumadami rin because of the food security as well as construction din po. And then pati na rin itong IT BPM natin because of the shift from the traditional learning system to blended or to a flexible learning modality po. So these are the three yung mga nangunguna na mga trabaho na pwedeng ma-applyan ng ating mga kababayan during this time na medyo nagkakahirapan ang yung mga ibang mga employment opportunities.
Salamat po. Salamat po. Thank you. Thank you, Secretary Harry. Salamat
We go back to you, Sec. Roque, please.
Opo. Secretary from Jillian Cortez ng Business World, basahin ko na lang din po yung tanong niya. President Duterte said it is the Western countries who prioritize profit when he mentioned about COVID-19 vaccines and slammed those who impose reservation fees. Who exactly are these pharmaceutical companies he was referring to? Are they US-based?
I suppose US-based din po, no? But there are at least two Western companies who have claimed to be on clinical trial third stage, no? That's the US and the UK.
Opo. How are the statements of the President going to affect current talks made with Western vaccine developers regarding COVID-19 vaccines since last week? The Department of Health said they are in talks with Pfizer and Moderna.
Wala naman po epekto yan. We continue to negotiate with everyone as in fact the President wants to ensure na magkakaroon tayo ng vaccine kahit sino pang unang makadevelop niyan. Thank you, Yusek. We go to Pia Renada, please.
Hi, sir. Good afternoon. Sir, just an update sana on the decision or the move to ban home quarantine. Has the IATF already consulted with LGUs and did the President say anything about this proposal?
Well, same status po. It's held in abeyance ang decision until we have consulted with the LGUs. I'm not aware if there's been any consultations because it was only last Thursday naman po na it was held in abeyance. But I'm sure it will be discussed again today and in the future meetings.
Okay, sir, just following up again on the President's SALN, because it's been a year since the President submitted his 2018 SALN, and until now, it hasn't been published. So may we ask what's taking it so long? And the President consistently promised to uphold transparency, and yet he's the first President not to publicize his SALN.
I do not know if that has not been made available, but what I'm sure about is it's been filed.
How about through the 2019 SALN? You promised to check if it has been submitted.
I'm sure it's been submitted, but whether or not it will be made public is outside of the jurisdiction of my office. But I'll inquire from the Office of the Executive Secretary.
Sir, how come you haven't discussed this issue yet on the possibility of making this public? Because, sir, it's a public interest document, right? And the President has consistently said that he respects FOI and that he would like to encourage all officials to publicize their SALNs, but he himself isn't doing it. I mean, have you even discussed the reasons why it's been kept from the public for so long?
I don't think the President is keeping anything from the public. The fact is, he's the only branch of government that has in fact issued an executive order, number 1 on transparency, and that is FOI in the executive branch of government. If you think it's not being made available to you, I enjoin you to resort to the EO1 in seeking the document that you want.
Yes, sir, we have done that several times.
Okay. Thank you. Yusek Roque again. Thank you, Pia.
A question from Samed Danila of Business Mirror. Meron na kayang desisyon si President Rodrigo Duterte on the appeal of Filipino nurses to extend the period of for exemption from the temporary deployment ban of POEA?
Wala pa po, and I think because si Secretary Bello has been unable to attend the meetings. No? I'm not sure if he's still in isolation, pero I will ask po na siguro in the next meeting with the President kung makakasama si Secretary Bello.
Aside from the filing of charges against alleged erring PhilHealth officials, what are the other recommendations of the task force investigating the alleged anomalies in PhilHealth, which was approved by President Rodrigo Duterte? Does this include the proposal of DOJ for the reorganization of PhilHealth by the GCG?
Sa rekomendasyon po na binigay sa akin ng kopya, at ito naman po ibinasa ni Presidente, wala na pong ibang rekomendasyon ang task force. Other than continuing investigation pa po. So yung mga kasong dapat isang pa po doon sa mga individual na na-mention sa report, panimula pa lang po yan, patuloy pa rin po ang magiging investigasyon at mas marami pa pong isasampa na kaso ang DOJ at ang Ombudsman. Okay, we go to Joseph Morong.
Hi sir, good afternoon. Sir, pengi kaming kopya ng report ng DOJ. I understand it's 177 pages, no? Pengi kami sir ha.
Apparently, I cannot release it because in a press statement, in a press briefing, USEC Mark Paredes said that DOJ also said it cannot release the report because it contains information on ongoing investigations by member agencies. The DOJ will instead issue an exhaustive PR that covers important and major portions of the report.
Okay. Sir, okay, going there sa report ng DOJ, so would we be able to quantify yung amount of money that was lost in this anomaly? Kasi ang daming mga procurement na problema, yung sa IRM, would we be able to quantify the amount of corruption that is involved in this whole investigation?
Well, it's a continuing thing, so I cannot, but a source within PhilHealth has told me and has told the Philippine Daily Inquirer that it is at least 100 billion pesos.
Will this be also the findings of the DOJ?
Wala namang ganyang finding ang DOJ. I'm just answering your question. But the DOJ itself, the task force itself, had no estimation. I'm unable to make an estimate, although simple mathematics, magkano yung IRM na binigay sa mga areas na wala namang COVID. Titignan dapat yung mga kaso ng mga nare-release na pondo intended for COVID sa mga areas na walang COVID. I'm sure may mga upcasing na tinatawag yan, pinalalabas na COVID na hindi. Tapos yung failure to prosecute and punish the perpetrators of anomalies, di-estimate mo kung sino yung mga yan na binigyan nila ng amnesty, magkano nahut-hut sa gobyerno, then you can come up with a figure. But I'm not in a position to do that now.
Sir, can you laymanize lang, sir, yung sinabi ng DOJ na strong admonishment versus the chairman who is Secretary Duque? What does this mean, sir? Parang warning lang at yung sinabi niyo po kanina mitigated kasi may itinago ng mga documents yung mga ExCom. Is that even possible na magtago at napalusutan yung chairman ng PhilHealth about all these potential anomalies?
Ako naman po, ulitin ko po, hindi lang naman po sa board chairman yung admonishment. It is intended to, quote ko po, the foregoing notwithstanding, the task force recommends that the President strongly admonish and remind the chairman and members of the board of the grave consequences of their action or inaction to the public, to the PhilHealth Fund. In other words, lahat ng taong gobyerno, we have to be good stewards of public funds. Kailangan pinangangalagaan mabuti po. At yan po yung sinabi naman ng report. Kinakailangan pagsabihan ang chairman at ang members of the board, including 5 cabinet members, na kinakailangan mas matindi ang kanilang pagbabantay sa pondo ng kaban ng bayan nang hindi po nawawala sa mga ganitong paraan.
Sir, just last 2 questions for you. Sir, yun pong sa decision ng DOTR, independent of maybe IATF, sir, is this symptomatic of how the government decides on policy? One department that decides on its own without coordinating with another agency that is relevant to the decision?
That was approved by the IATF. I heard it myself in the IATF meeting, and no one objected. Kaya naman, ang punto naman ng DOTR, and I raised this with the President in fairness to the DOTR, it was approved by the entire IATF because it came after the report by Secretary Chua of NEDA showing through data how you cannot open the economy without increasing access to public transportation. So wala naman po nag-object sa meeting na yon. Wala nga po si Secretary Duque nung mga panahon na yon, pero nandun po yung kanyang mga alternates. No? At napakadaming alternates po ng Secretary of Health sa IATF. I can assure you that no less than 4 or 5. So dapat kung meron ng complaint, and I share the sentiment of Secretary Tugade, dapat nagsalita na sila. No? But ang basa ko naman dito, ang nagsalita talaga ay the private medical practitioners, and the president naman, in fairness, they wrote him. He responded right away, no, by bringing this up to the select members of the cabinet yesterday. But even before the president brought it to our attention, talaga naman pong naka-agenda na siya for this afternoon. Dahil hindi nga po pwedeng baliwalain naman ang mga punto de vista ng mga medical frontliners.
Kay Secretary Galvez, Sir, kung hindi lang short.
Okay,
Sir, last night you said that there's something like 120,000 possible cases. That's why you underscored the need for more isolation facilities. First, on the figure, tama ba, sir, yung rinig ko, 128,000 possible cases? And if this is so, is this not worrying na baka ma-short tayo ng isolation facilities? At this point, how many do we have and how many more are we anticipating to isolate?
Nakikita po natin na yung sa lahat ng na-isolate natin is 24,538. Tinitingnan kung hindi po ito na-isolate. Ito po ay nag-continue sa home quarantine. Magkakaroon tayo ng exponential growth nito 3 times or even 4 times or 5. Kasi hindi compounded. So, kung hindi natin naitanggal ito sa NCR, at sa Region 3 at sa Region 4, hindi mababa yung active cases natin. Napakaklaro po eh. Noong August 14, ang ating active cases is 88,109. Ngayong September 53,754. So instead na mag-increase exponentially, napababa po natin yung active cases na 34,055. So nakikita natin yung direct correlation ng ating aggressive isolation. At i-explain po sa inyo na yung pinaka-primary role ng tracing, contact tracing, at saka testing is to isolate the patient. Kung hindi po natin ma-isolate yun, ay para po tayong nagsasayang lang ng pera sa testing at saka contact tracing. Ang pinaka-ano natin, ang tinatawag natin decisive point ng ating strategy is how we can unearth the unseen enemy and isolate him or prevent him from transmitting the disease. So, klaro-klaro kita-kita sa figures. At sa report po natin kay Presidente, sa buong NCR, 35% po ang decline ng cases. Meaning, nung nagsimula po tayo ng Oplan Kalinga, napakabilis ng pagbaba po. And then, ang nakita po natin yung sa mga lessons learned natin sa Cebu, yung 1,900 na home quarantine, nung in-extract po natin, nakita po natin ang Cebu, ngayon hindi na tumataas. Even nag-NGCQ na siya. So, klaro-klaro yung ating natin. And then yung nakita po namin, pinlano po namin yan, kaya naisulot po namin na maisama sa bayanihan po yung 4.5 billion. Na-compute po namin na sa 4.5 billion ay pwede po tayo tinatawag na isolate sa mga hotels na 128,000 COVID positive. So ngayon, nagkaroon po na tayo ng arrangement sa DOT na yung lahat ng 3-star, 2-star, at yung mga hotels ay gagawin po natin quarantine facility for positive at saka OFW. So sa staycation po, 4-star at saka 5-star po ang staycation.
Okay, sir. Thank you for your time po.
Thank you very much, Joseph. Back to Yusek Roque, please.
Yes, Secretary, meron na lang tayo ditong 4 na tanong para sa inyo. From Joyce Balanso ng ABS-CBN, 6 months into the lockdown, nangangalampag daw po yung union at workers ng konkretong plano from government on joblessness. Ano daw po ang reaction ng palasyo?
Well, ang reaction po natin dyan, kaya nga po binubuksan natin ang ekonomiya. Kaya nga po naglunsad tayo ng isang kampanya, information campaign na Ingat Buhay para sa Hanap Buhay, para mainganyong lahat po na lumabas, magtrabaho at kaya naman po magtrabaho kung pag-iingatan natin ang ating mga buhay. Nandyan din po yung mga pondo na linaan natin para ipautang sa ating mga kababayan para magkaroon ng sariling negosyo. Yan po ay nasa loob ng Bayanihan 2. At bukod pa po dyan, abangan nyo po yung 2021 budget dahil marami rin pong mga stimulus na nakapaloob dyan sa 2021 budget.
From Van Fernandez, reaction po sa sinabi ni Senator Soto na dismayado daw po siya dahil hindi kinasuhan si DOH Secretary Duque at PhilHealth SVP Roberto De Rosario ng DOJ at Task Force na nilabag ang Article 217 of the Revised Penal Code dahil sa kapabayaan sa paggamit ng pondo sa korupsyon. Kaya pinaubayan na lamang daw po sa Ombudsman.
Wag gaya ng sinabi ko po, panimula pa lang naman po ito because they had very limited period of time given to them with the President, 30 days. Magpapatuloy pa po ang investigasyon ng DOJ, magpapatuloy pa po ang investigasyon ng Ombudsman.
From Salarina Monte, Manila Shimbong, regarding daw po dun sa admonition against Secretary Duque, posible bang nakaapekto ang unang sinabi ni Pangulong Duterte na mistulang iniligtas niya na ang kalihim nung sabihin niya dati na posibleng hanggang negligence lang kung meron man ang dapat maipataw sa kanya at hindi mas mabigat na criminal case.
Hindi naman po siguro kasi kung ganun, dapat wala na admonishment na rinekomenda.
From Vance Fernandez, para daw po kay Secretary La Peña, kung nagsimula na daw po ba ng contact tracing training ang TESDA para daw po i-assist yung tracking down some individuals na nagkaroon po ng COVID-19 positive.
Yes, ma'am. Nag-umpisa na kami. In fact, it started here at NCR and with 25 mga trainees ang ating na-train na, and this will be these mga trainees na ito will be duplicated in all the regions in the country. So this is a priority activity ng TESDA as our part in the minimizing or the stop of the spread of the coronavirus.
Okay, Secretary La Peña,
Okay.
salamat po.
Maraming salamat, Yusek Roque. Maraming salamat sa ating mga naging panahuhin, ang ating Chief Implementer, Secretary Galvez, at si Secretary La Peña ng TESDA. Maraming salamat din po sa mga miyembro ng Malacanang Press Corps. Sa ngalan po na ating Presidente, ito po ang inyong spokes Harry Roque nagsasabi, kaya po natin ito, ingatan natin ating mga buhay para tayo po'y makapaghanap buhay. Maraming salamat po sa inyong panonood. Hanggang sa Huwebes, magandang hapon po sa inyong lahat.
Matinding kalaban ng COVID.
Ayokong makahawa.
At mahawa.
Pero kailangan ko na magtrabaho.
Kaya di ako magiging pabaya.
Di matigas ang aking ulo.
Iingatan ko ang aking sarili.
Para maingatan ang pamilya ko.
Ito ang ambag ko.
Ako,
Ikaw.
lahat tayo.
Sama-sama nating
Mayaangat ang bayan.
Basta't sama-sama tayo.
Sa pag-ingat buhay.
Para sa ating hanap buhay.
Mask, hugas, iwas.